Point to the pain in your lower back right now. Are you pointing to the exact center of your spine, or are you pointing off to the side, right over the dimple just above your buttocks? Does a sharp, stabbing pain wake you up the moment you try to roll over in bed? Does it hurt terribly when you take a long stride while walking, or when you climb a flight of stairs?
If you checked these boxes, you are likely suffering from Sacrodynia.
Your pain is not coming from a damaged spinal disc. It is coming from severe inflammation in your pelvis, specifically a condition called sacroiliitis. To understand this pain, you must look at the biomechanics of your skeleton. Your spine does not just float in the air, it sits directly on top of your pelvis. The connection point between the base of your spine, the sacrum, and your pelvic bones, the ilium, is called the sacroiliac joint. Think of your spine as the mast of a ship and the pelvis as the hull. The sacroiliac joint is the heavy-duty structural shock absorber that connects them. It is designed to transfer the entire weight of your upper body into your legs. It is only supposed to move a few millimeters. But if that joint becomes overloaded, irritated, or arthritic, that heavy-duty shock absorber turns into a grinding, inflamed hinge. This anatomical overlap creates a catastrophic trap in modern medicine. The inflammation in the sacroiliac joint irritates the nearby nerve roots. It shoots burning pain down your buttock and the back of your leg. It perfectly mimics a herniated disc causing sciatica. Here's the hidden danger. If a surgeon looks at a minor, harmless disc bulge on your MRI and decides to perform a spinal fusion at the L5-S1 level, they will permanently lock your lower spine. This forces your sacroiliac joint to take on double the mechanical stress. You will wake up from spine surgery and your sacroiliitis will actually be much worse. You cannot fix a pelvic problem by fusing the spine. You cannot diagnose sacroiliitis by just staring at a standard lumbar spine MRI. A standard spine scan usually stops right above the exact area where the sacroiliac joints begin. To find the mechanical truth, a doctor must act like a detective. We must expand the imaging to include a dedicated MRI or CT scan of the pelvis. We are hunting for specific radiological markers. We look for bone marrow edema, which is active fluid and inflammation inside the pelvic bone, or sclerosis, which is abnormal bone hardening at the joint line. We must prove the joint is damaged before we touch it. Because this is a completely different joint, the treatment is entirely different. We use a strict two-step protocol. Step 1. Confirm the target. We use X-ray guidance to inject a precise dose of numbing medication directly into the microscopic space of the sacroiliac joint. If you stand up and your back and leg pain instantly vanishes, we have proven the diagnosis. Step 2. Silence the joint. We do not perform open spine surgery. We use advanced techniques like radiofrequency ablation. We use controlled heat to safely disable the specific tiny nerve cables that are sending the pain signals from that arthritic joint to your brain. If you've been treating your lower back for months, but the pain refuses to go away when you roll over in bed, you are likely treating the wrong anatomical structure. Do not let anyone operate on your spine until you have ruled out the pelvis. Let our expert neurosurgeons review your complete medical imaging. Click the link in the description to upload your MRI or CT scans to our secure portal. Let us evaluate your spine and your sacroiliac joint, give you a definitive second opinion, and ensure you are targeting the true source of your pain.